Centura Transplant, how may I help you?
Used to be so afraid of all the problems in my way. Thought I'd never see the day I'd get there. But now my heart has taken wing, and I can do most anything. Now that I have learned how to believe my dreams are real, reach for the stars. You can be who you want to be. They're not too far if you believe. Reach for the stars. They are your destiny. Be who you are. Follow.
After I was diagnosed, I was looking everywhere for answers, so I was just anywhere and everywhere.
An easy way to start in an evaluation of one or multiple transplant programs is to go to ustransplant.org. This is the Scientific Registry of Transplant Recipients. The results are given in a very user-friendly format. If one were thinking about several different transplant centers, one could go to this website and check out these results before ever even calling.
Well, I think as a patient who's looking for a transplant program, there are a couple things they need to look at. First and foremost, they need to look at what are the outcomes of those transplants, and that data is available to the public. Secondly, I think that you need to find a place where you feel that you fit and can develop a bond to, because a transplant is an event that typically can wed you to an institution for some time, and I think that you should have a good feeling about how that feels.
I think you have to look at the quality of the clinicians that are engaged in the program and conducting the program. You have to look at experience, of course, and you have to look at the level of care that's provided by any program. A lot of times it boils down to how you feel about the people who are providing your care. Do you get a sense of trust when you meet with them? And whether you have easy access to them or not. And how quickly can you get in touch with your clinician, if you will, or your physician or your transplant nurse coordinator if you need the answer to a question.
They're on call, like in the middle of the night. You know, I had a question and I thought, do I go to the emergency room? What do I do? I paged Tanya and she calls me back at 3 o'clock in the morning with the answer.
All I have to do is make one simple phone call. If I ever had a question or a problem or a concern, I just called Darlene Long and it was taken care of almost instantaneously.
I love porters. I mean, they have given me the care. Every time I call, I get answers within minutes.
I think individuals should choose the kind of environment, the kind of professionals, the kind of center that they're comfortable in. There is a lot of discomfort, not just the surgery, but they're challenging issues. There's having to get labs when it's inconvenient and paying attention to diet that might be inconvenient. And all this should be in an environment that one's very comfortable with. That will make it easiest.
The fundamentals of a program is you have to have good success rates. That's a given. But what truly makes a program better than another is the level of service that's provided by the people who are in that program.
I think the advice that I would give people is to become just absolutely as knowledgeable as you possibly can, and the internet is a tremendous tool to find that type of information out. A lot of times you'll find there's just so much information it's hard to digest, but I think just like a lot of things in life, you look at the people, and if you trust the people and the people say they're going to do what they're going to do, and you have a good feeling about that, that's where you go.
I think you should be a consumer in healthcare as you are in other areas, and that is to get as much information as you possibly can